don't have that.
Okay. Is that you, Robert? All right. Yeah, we're about to start.
All right.
So I just have to send one more. Of course, everyone's hitting me on the phone because they lost their link. Okay. Good evening, everyone. Welcome to Know Better, Live Better with NRWP. And if you don't mind, we would like to take this opportunity to have a moment of silence for those 14 children and one teacher of Robb Elementary School located in Uvalde, Texas, that had their lives sacrificed to them. A moment of silence, please. Thank you. Once again, good evening. My name is Andre Early, and welcome to Know Better, Live Better with NRWP, which is the New Rochelle White Plains Alumni Chapter of Kappa Alpha Psi Fraternity Incorporated. And I will be serving as one of your trusted messengers for this evening.
Okay. And with that, I would like to introduce myself as well. My name is Robert Bowen. I'm also a member of New Rochelle White Plains Alumni Chapter of Kappa Alpha Psi Fraternity Incorporated, and along with Brother Early, serve as your trusted messenger.
Thank you, Brother Bowen. This evening, we are joined by Know Better, Live Better staff members, Farrah Cater, as well as medical professional from Westchester County's Department of Health, Dr. Dow Hewlett, who just happens to be a member of Kappa Alpha Psi Fraternity Incorporated as well. But at this moment, I need to turn this part of the session over to Farrah.
Okay, thank you, Mr. Early. And I should say we also have Erica Williams-Woodley here, who also works with us at the health department. And I am sure many of you already know her. So thank you all for your time. Really quickly before I leave it up to our presenters, you're gonna be asked to fill out a voluntary survey in the chat. I'm going to put in the chat box a little survey link. You do not have to complete all or any of the questions if you don't want to answer them. In a moment, we will explain the purpose of this program as a whole. The purpose of the survey is to collect information for a study about the effectiveness of this kind of community-based health program. We worked really hard to put together something that's discussion-based, something that's going to hopefully improve people's health, people's trust in the healthcare system, and their knowledge about healthcare resources in the county. This is a confidential survey. The people who are going to review the survey responses come from the Westchester County Department of Health and Mercy College. If you have any questions, comments, or complaints, you can reach our contact information on the first page of the survey. If you decide to participate, your responses will be submitted and saved on a secure server. They will be not attached to your names. We may publish the results of the survey in a paper or share them with health departments and programs to encourage them to invest in discussion-based programs like this one. We will use the email you used to register for the WebEx conference to send you an Amazon gift card for $10. This is to compensate you for your time and participation in the information session, but not for survey completion. So you will still get the gift card if you leave the survey questions blank or if you don't answer them at all. So with that, I will put the link in a chat, and I'm also giving you the link to 2 handouts that you can use as a reference during the presentation today. Right, thank you.
Thank you, Farah. So at this time, as you make your way over to the chat room, you will see the first entry with the pre-survey link. So please take this time. And as you do that, just for your information, this program is being run in different community sites around Westchester County in collaboration with the local health department and different organizations such as NAACP chapters, Family Services of Westchester, and other social and community-based organizations. We are also bringing it to you here so you can have some tools and information to help making health decisions. We will talk about health overall, but this evening we will also be covering COVID-19 and how difficult it has been to decipher all the different information coming out, and that sometimes seems, conflicting. We are thankful that you are all here and have decided to participate. So with that being said, let's get started. I need to share my screen. Oops. For some, and prayerfully, all will see who was before us and what is the Know Better, Live Better program. Noted poet laureate, our sister, Maya Angelou, quoted, "Do the best you can until you know better. Then when you know better, do better." Take it from here, Rob.
Yep. So you see these words, and I'm pretty sure most of us on this Zoom have, heard them a time or two. But the real purpose of what we're trying to do here today is not to just really, inundate you with a bunch of information, but it's to have a conversation, okay? And throughout this presentation, okay, I want everybody on this call to just keep that in mind, that this isn't us talking and just listening, but more of, if you have questions, please put them in the chat. But then also know that this has been a difficult time for everybody these last couple of years, okay? And what we're trying to do here today is not just tell you the right thing to do, but to spread awareness, okay? To spread the fact that, hey, we're all learning, but we have medical professionals on the call. So I might not have an answer, but doctors may, okay? And this is a forum where you'll be able, hopefully, to get those get those questions answered. And if not, we'll be able to point you in the right direction to where you can get those questions answered. Next slide, please. Okay. So just touching on basically what I was just talking about, as far as we've all dealt in this pandemic in different ways, okay? Just to give a quick little background, as far as for myself, I work in the public school system in the city, and I work with elementary school children. Okay. So, of course, it's affecting me differently than maybe others on this call. But as I stated before, this isn't me, spitting answers to you. This is us having a conversation, how we can support each other to be healthy in our community, to spread awareness in our community. Next slide, please. So as you see on the screen, we're trying to basically cover three things as far as, one, what does this mean as far as know better, live better? Okay. This initiative that Westchester County is doing, we want to bring more awareness to that. But then also, and I would actually say this is probably the most pivotal point, is that, hey, with all the ways that you can find information nowadays, okay, there's no reason why it should be hard for you to find the information that you need. So when it comes to health information, when it comes to finding trusted information, okay, hopefully you leave this call knowing where you can go, knowing where you can find resources if you need them, okay? And lastly, as far as when it comes to our healthcare and our overall health, okay, having a conversation about that, whatever your health status is, okay, just bringing general awareness as far as the positives on having a regular healthcare doctor. If you have questions about where can you go or something that might be ailing you, hopefully we can point you in the right direction or answer those questions here. Okay, next question. Next slide.
So with that being said, I'm going to stop sharing my screen for one quick second, and we're going to go into the chat room because we're going to ask a question. In your opinion or your experiences, what is a chronic disease? Feel free to put that your response in the chat room. What is a chronic disease, and why is this important to know? We asked that question because, once again, we're focusing on COVID-19, and when it comes to the impact of those that truly were affected, we need to talk about chronic diseases. Okay, so we do have a response, one so far, a disease that does not go away. A disease that does not go away. Brother Hewlett, would you like to expound on that?
Sure. That actually is one way of thinking about it. There are chronic diseases which are diseases that we cannot cure, but they are diseases that we can manage. Some typical examples would be diabetes, hypertension, chronic lung disease, asthma. A lot of us have asthma. These are conditions that we may have throughout our lives, and they can be managed. And if we manage them adequately, this can lead to a prolongation of our life, hopefully, and also improve the quality of our life. And that really is one of the main functions of primary care physicians.
Thank you, sir. And just on a little, a personal testimony here, it's interesting. For years, I had to go to the doctor, and my primary care physician would always ask me, does diabetes run in your family? Does, asthma, a list of, sicknesses, diseases, conditions. Dr. Hewlett, I couldn't answer the question. The reason why I couldn't answer the question was because I did not know my biological family. And it wasn't until just a few short years ago, I made contact with them, I located them, and after the initial shock, believe it or not, one of the top questions I asked, let me know what's going on with the family medical history. So I know what I'm dealing with as I'm starting to mature, quote unquote, get older. And guess what? Diabetes runs in the family. Heart disease runs in the family. So I was proud to go back to my physician sometime after this introduction and finally answer those questions. And now we could actually work towards improving my roadmap through, taking care of myself. So we definitely understand the importance of knowing family medical history when it comes to chronic diseases. Another one, sickle cell. Doesn't go away, but can be managed. Thank you. Rob, I'm going to go back to sharing my screen.
All right. Just give us a moment.
Yeah, I'm sorry.
No, it's fine. It's fine.
You don't want to. Doesn't want to cooperate with me right now. All right, go ahead.
Okay. Okay. So one of the keys to my job, and if you hear me using a lot of personal experiences that I have, I actually do this same kind of work in my field of work. And I find that rather than telling my parents or telling people what this is, what the stats are, it's better to use personal experience and really connect with them one-on-one. Okay. So just to touch on what we see on the screen as far as preventing disease, catching a problem early, and, managing, chronic diseases, right? All of this can just come down to one thing, okay? Do you have a primary physician or a doctor that you can trust, okay? And how regularly do you go to the doctor? How regularly do you take your kids to the doctor, okay? Now, it seems like a very easy question. It seems like something very simple, right? But we also have to keep in mind that, one, not everyone has healthcare. And if they do, not everyone trusts their doctor, okay? And the reason why this is so important is because if we're not going to the doctor, if we're not trusting our healthcare physicians, okay, then we're not. And if we can't catch it, okay, these things progress. We can't catch the problems early. We can't even prevent it. We can't even prevent the disease, okay, because we're just saying, hey, I'll be fine tomorrow, or I'll be fine, and we're not catching it. Next slide, please. Being healthy, as far as being active, okay? Again, it's one of those things where it sounds very simple. It sounds as if, oh yeah, that's straightforward, okay? But in reality, you don't have to be a track star. You don't have to be an Olympian, all right? You don't have to go to the gym every day. All you have to do, okay, is make a conscious effort, okay? Whether it's, you know what, I'm going to take a 10-minute walk today, or it could be something as simple as, you know what, rather than going to a fast food restaurant, or rather than cooking this fried meal, I'm gonna bake, or something like that, okay? And when it comes to something like feeling less anxious, and as far as the mental aspect of, okay, when your body feels better, when you feel more in control, when you feel more healthy, you'd be surprised just how much less of a mental toll it takes on you, okay? Because studies have shown that exercise is actually a great way to relieve stress. And stress is one of those things where you can't really quantify it in numbers, but if you're stressed, it can affect you in all different type of ways, right? Whether it's mentally, physically, All of a sudden, you didn't have back problems, and now you have back problems now. You weren't even on your feet all day, but now your feet hurt. Okay, that's how much. Okay, when it comes to the mental side of it, if you're not taking care of yourself, whether it's physically or mentally, you'd be surprised just how it snowballs. Next slide, please. Now, again, rather than spit statistics to you, I want to give you a very short experience, okay? When the pandemic first hit and you heard about the science when it came to the COVID vaccine, the COVID-19 vaccine, okay? I'll raise my hand and say that I was skeptical, okay? I was skeptical. Even though you're seeing on TV and I'm seeing the health data and it says that it's 100% safe and that it's our best fight against COVID, right? But then, and you know what really started that skepticism? Okay, is I would see on social media, even if I knew it wasn't true, I'd see it all the time. Okay, you don't know what they're putting in it. You don't know what's in the drug. How could they make a drug so fast? It's going to affect you down the road. Oh, it's going to make your arms turn blue. Things like that. Oh, I know somebody who took the vaccine and now they can't walk. Okay. All these types of information, even though I knew they were false or misleading, still affected me. Okay. But I can tell you, and this is just from a personal experience, okay, what changed my mind, what really changed my mind is that when I really sat down and thought about it, and then when I actually spoke to parents about the vaccine, I realized I want to be in this world and I want the best chance to do that, not just for myself, but for my loved ones. And the vaccine gives me that. Okay. And the reason I brought up that story is because we see the falsehoods out there. We see the information. Okay. We see the misinformation. Okay. But rather than when you're speaking with somebody, or if you have a question about the vaccine, this is the forum. Okay. If you have a question that you feel might be, either out there or you just want to know, ask. We have the health professionals on this call, okay? So that anything that you might have heard, something that you think you may know, okay, you can get answers here, right? And that's what it is. Nobody likes to be talked to, right? Everyone likes to be listened to, right? And that's what, especially on this call, I want everyone to just feel as if you have a question, we will listen and give you the best answer possible. Next slide, please.
Hold on one quick second, sir.
Of course.
And Dr. Hewley, you can chime in on this one real quick. Let's from a historical standpoint, we actually had, the Spanish flu, right?
Yep.
And then, of course, the deaths that ensued after that. Personal experience. I actually got the flu for the first time back in the early 90s. Never had the flu before. I didn't take to it too well at all. After I recovered, I started getting the flu vaccine, the flu shot. Mm-hmm. Now, it wasn't until later on, I would have to say about 10, 15 years later, I ended up catching the flu again because this specific year, I was unable to get my flu shot. And when I tell you, I called my sister and said, look, I don't know if I'm going to be with you in the morning. So I need you to check on me every 15 to 30 minutes. The impact of a flu vaccine, which by the way, if I'm correct, sir, kind of the strain changes, like sort of kind of every year, correct? So as we process, a COVID-19, a COVID vaccine, what are we, what should we expect moving forward? Because in my head, I'm a very simple guy. From a common sense, I'm expecting a COVID vaccine shot every year, probably starting within the next 2 or 3 years. I think you're muted.
Can you hear me now?
Yes, sir.
Yes.
Okay. All right. I'm sorry. Yeah, Brother Early, what you're saying, I think, is absolutely on point. I have had the privilege of attending some of the committee meetings, and it does appear that we may be going towards a situation where we will have to take this vaccine or some form of it on an annual basis. The virus has been changing very rapidly. The hope is that it will be incorporated into our routine healthcare and that it will not be something that will be disruptive. What you said about the flu, I think, is extremely important because the flu is still a major cause of disability and death in this country. And so it's important for adults and children to take the flu shots. We're especially worried about our young women who may be pregnant because the flu can be deadly to women during pregnancy. We can say, and there are some striking parallels between the flu and the coronavirus as well. So I think that you're absolutely on point.
Thank you. Thank you. And to that, we do have a comment in the chat, and maybe you could chime in on this. The biggest question is the adverse reactions going forward.
Sure, we can comment on that. There are at least 3 different systems which have been set up to monitor the safety of the COVID vaccines, all of them. And to date, the occurrence of serious adverse events, as we call them, has been extremely low. I was looking at the data just a few days ago. In children between the ages of 5 and 11 years, there have been over 18 million doses given to children in this age group. And I think that there have been about 251 events which were considered serious. And there are a lot of events that get included in that 251 out of 18 million doses. And it's considered serious if it requires a person to go to the emergency room to be managed on a very brief period of time. And so in nearly all of those cases, people actually went home from the emergency room. So that gives you an idea as to the low frequency of serious events related to the vaccines.
Great. Thank you. Thank you. Actually, something else just came up. Is there a possibility of scientists finding cures for viruses, such as the flu or?
Yes, I think we're all hoping that we will be able to do that. I think that we have to acknowledge the fact that fortunately we do actually have antiviral treatment. There are medications that people can use, and everyone on this call should be aware of the medication called Paxlovid, which is part of what we call the Test to Treat program. And so anyone who has tested positive for COVID and who is having symptoms can ask their physician to write that prescription for them, and the physician will essentially review their medical record and make sure they don't have any contraindication. But they actually should take that medication as soon as possible. There are other, and it's only for 5 days, twice a day for 5 days. There are other medications that are given to people in the hospital who are more severely ill. And these medications are given intravenously. One of them is called remdesivir. So there are a lot of advances that have been made. I think the thing we want to emphasize with COVID specifically is prevention. You know, the old adage, an ounce of prevention is worth a pound of cure. And so the vaccine is clearly the best way for us to go. But we know that some people, regardless of taking the vaccine, may still get sick. And so it's important for us to understand that there are effective treatments that will help us to manage condition.
Great, thank you. Okay, so just two more, and then we'll move forward. One question was, is there a second booster being considered due to the current rising numbers? Or is it, or I could word it a little differently, in which is it going to be recommended that we get a second booster? I know me personally, I did get a first booster after the first cycle of shots, and yeah, well, I'll let you answer that.
Yes. This is a moving target. The committee, it's called the Advisory Committee on Immunization Practices. That committee met about 3 weeks ago and again last week. Now it is advisable that for those of us who are over the age of 50, that we should actually get the second booster. And I think that this recommendation is now pretty firm. Previously, it was felt that that the booster was kind of optional and that you should wait until the fall. But now with this current surge, it is recommended that those of us over the age of 50 should receive it. Also, anyone who has an increased risk for developing complications, so people who are immunocompromised, and there are a number of conditions that would put a person into that category. People that are immunocompromised should receive the second booster as well. And I think you should all be aware of the fact that our children between the ages of 5 and 11, a booster is now recommended for those children, and that should be given to them 5 months after they have completed the second dose of the medication. And down the pike, we are hoping within the next month, there's going to be a recommendation for our little children, children like my grandchildren, who are under the age of 5, so that they'll be able to take a vaccine as well.
Great. Hey, Rob, you see what's going on in the chat?
Yes, I do. And
I want to stay on. Stay on top. I want to stay on track, but I think it is still important that we respond to these.
Yes, and actually, so we'll keep going with the presentation, but I'll have the doctor, if you could just hold on for a second. I know that these questions, they're going to keep coming.
Yeah.
This is it. And this is, this is the gist, okay, as far as being interactive, okay? So we'll keep with the presentations, but again, keep those questions coming. All right, we're going to get back to these questions. And then if you have something else, keep it going, okay? So we're going to keep going with the
all right, so just follow what I'm about to do, though, okay? And as Dr. Hewlett, we're gonna leave you with this one real quick, and then we're gonna move forward because you did mention, I believe, Paxlovid earlier.
Yes.
Is that recommended for everyone? Should they wait to check on the severity of the system of their symptoms? And would you take it if you tested positive for COVID today?
Yes, I think if you're symptomatic, I believe that the age range is that you have to be over 12 years of age. So I don't think there's a recommendation yet for children. The caveat is that it's important that you not have kidney failure. That's one of the things that can be a complication. So people that have kidney failure, other treatments have to be given to them. And there's a list of medications that people might be receiving, and it's important for your doctor to briefly go through that list and make sure that you're not receiving one of those medications that would be a contraindication. So the answer to the issue in terms of symptoms, if one has symptoms, particularly if they're severe, one should take the Paxlovid. One shouldn't wait until the symptoms become so severe that you're on the verge of going to the emergency room. With any infection, the sooner you take a medication, the better your chances are of having a good outcome. And so I urge people, since this is out there and the medication is extremely well tolerated, as far as we can tell, it's safe. It's one of those things that I think people should really avail themselves to it if they are symptomatic and have tested positive. And I think people, particularly with what we started out with, the chronic underlying diseases, diabetes and heart disease and hypertension and sickle cell and other conditions like that, those are the people that we worry about the most. And so I think that those would be the ones who should really seriously try to get the medication as soon as possible if they test positive and have symptoms.
Thank you. Thank you. All right. So what I'm going to do right now, Rob, I'm going to share my screen.
All right.
All right. But
Yep.
just check the slide that it's going to be on. Okay.
No problem.
Because I'm pretty sure Dr. Hewlett will be able to respond to a few of these items in regards to this one right here.
Okay. Benefits of the vaccination. So it's ironic because the questions that were just posted in the chat actually are about to reinforce what I'm about to bring up right now. Okay. And, moving forward is what we're going to be talking about in these next couple of slides. And that is, notice how this interaction between ourselves and the doctor, where we have these questions and he's able to give you answers, right? Just you don't have to put in the chat, but just a quick train of thought. How many of you that are on this call right now are comfortable enough with your doctor where if you had questions like this, you feel confident that you can have this kind of dialogue, okay? And the reason I bring this up is because to me, I feel like it all comes together, right? The questions or the hesitancy that you might have for the vaccine, okay? The benefits of the vaccine, right? The statistics, right? No matter if I give you all of the details and I tell you that all of the trusted doctors and everybody says, Dr. Fauci and everybody says you should take it, okay? If you don't trust them, or if you don't have a trusted doctor, if you don't have a relationship with your primary care doctor or with a doctor that you've gone to, then all of those facts, think about that, okay? That even what you see on the screen, as far as the benefits of the vaccine, and you've heard about the benefits for months on months. What does that matter if you don't have a relationship with your doctor, okay? And hopefully by the end of this call, at the end of this meeting, right, if you don't have that relationship, hopefully you'll start to build it. Or let's say I need to find a better primary care doctor, or I need to find one, okay? By the end of this call, we'll be able to give you the tools where you can find one, and we can give you the resources where you can find one, okay? Next slide, please.
Dr. Hewlett, can you do it? I'm going to stop sharing the screen. I'm sorry. Can you do us a quick favor? And because the commercials have started popping up, can you explain long COVID and how it's impacted?
Sure. Long COVID is essentially the prolongation of symptoms after one should have recovered from the illness. So we know that when you have COVID, you're on isolation now for 5 days, and you should wear the mask for 10 days. And in most situations, after that 10-day period of time is over, you should be feeling back to the way that you were before the illness. unfortunately, in anywhere between 10 to 40% of people, symptoms persist. Some people continue to have severe pains and muscle aches and all types of things that might almost mimic arthritis. Some people may have neurologic complaints where they feel that they're not able to concentrate on their work. And we have people who say that, you know, they go into work, but they really have a hard time concentrating. And we've referred to this as brain fog. And that actually is a very real problem. There are some people who have persistence of respiratory complaints, people who complain of being short of breath after just minimal exercise. And we had an example of that at the health department where we had a gentleman early on or a woman actually early on during the pandemic, and she was working as a police officer. And when she went back to work, she found that she really couldn't function because she needed to run during certain situations, and she couldn't do that anymore. And so these are real problems that are part of long COVID. One of the things that has been found is that we need to have more doctors who are going to be more knowledgeable about long COVID. And we also sometimes find that people can have some reduction in symptoms if they actually take the vaccine, if they hadn't had the vaccine before they got sick. But it's a major area of research, and it is one of the things that is one of the number one things for research in health and human services, because we know there are a lot of people who are debilitated because of long COVID.
Thank you. And as we go back to, I believe the next slide, for those really paying attention to the chat room, the last entry, there is a link that was provided for more information about the oral antiviral treatment that Dr. Hewlett mentioned. So feel free to click on that link. All right. All yours, Brother Bowen.
All right. And thank you for that. And again, moving along. And again, this is why I like the interaction, especially when it comes to the chat and the questions, because the questions that you ask are the points that I plan to make during this presentation. So when it came to the last slide, as far as why it's so important to have that relationship with your doctor, where you can talk to your doctor as far as like, hey, I'm past that 10-day interval or however many days that they say I should be done with COVID, right? I don't test positive for COVID anymore. Why do I feel this way? Is something wrong? If you have that relationship with your doctor, okay, you're able to ask these questions, right? Which is why it stems to the root of it. If you have that relationship, use that relationship. If you don't, okay, understand that whether it's through this website, Know Better, Live Better, or another website, okay, there is a doctor out there for you. All right. So going on to the next slide, and it all just rolls in together, the side effects, the rare adverse effects. Now, Dr. Hewlett brought up a very, very important stat, right? And I'm going to say it again, and please correct me if I'm wrong, doctor, but out of 18 million people, or out of 18 million, let me make sure I get the demographic right. Out of 18 million children between 5 and 11, okay, there was only recorded adverse effects of about 271, okay? Now, I might be off a few, maybe one or two, but you see the huge gap in disparity, right? However, I'm pretty sure, or if nobody else on this call is, I know that for myself, when I actually took the vaccine, I had some side effects, okay? And why am I bringing this up? I started with the stat, and now I went to personal. It all comes back to that vaccine hesitancy. The reason I personally waited to get the vaccine is because I was afraid of the side effects. I was afraid that once I got the vaccine, something might happen to me down the line. I might not react to it right. I even had friends who had had a somewhat adverse reaction. So I was nervous. I was scared. And when I got the vaccine and then I got the booster, I had some kind of side effects. But once I actually spoke to my doctor, I realized, well, that soreness in my arm, that not feeling your 100% best the next day, that's not the end of the world. That's okay, right? But it was because I was able to ask him that question, and I'm being honest, I was terrified. But being able to talk to him and look him in the eye, and him able to look me in the eye and say, Mr. Bowen, you're okay, right? And have that conversation with him. Now, when it comes to the side effects or the rare adverse effects, and this, Dr. Hewlett, if you could just speak to this, because I know, even without looking in the chat, that this is something that's in the back of everybody's mind, because you know what? It might be 1 in a million, but I believe that I am that 1 in a million because I'm that special. So, and I'm just that amazing. So if it's a 1 in a million chance, that of course it's going to happen to me, doctor. So, doctor, what are those side effects that, you could explain to the people on this call that even though it's a 1 in a million chance, what are those side effects?
Okay, well, let's go through the things that are most likely to occur. And I'd say that most people will have a sore arm, as you had, Brother Bowen.
Yep.
Many of us, when I had the vaccine, the day after I received the vaccine, I felt tired. And in fact, I was at work and I felt myself falling asleep during a meeting. There are some people who will have chills, and they may even have fever. We refer to this as reactogenicity. And essentially, the analogy I will use is when you are getting into condition and you start exercising, it's been said, no pain and no gain. Well, when you take a vaccine, your body's immune system is being exercised. And when your body's immune system is being exercised, you will start to have some things that will almost mimic having an infection. So you'll get some chills. You may have some fever. You may have some fatigue, but those are short-lived, and it will usually only be for a few hours and you will get better. Now, what are some of the side effects that have been described that are very rare, but they were in the news? The one that I think comes to mind most often is myocarditis, which is an inflammation of the heart muscles. That has been described most often in adolescent males. There have been some cases in females, but mostly adolescent males. It's been described most often after the second dose of the vaccine. And in nearly all of the cases, it has been self-limited. The thing that people complain about is they'll notice a rapid heart rate. They may have some shortness of breath. And when they go to the emergency room, that's when it actually is diagnosed. In most of the cases that were reported to the system, the people were admitted to the hospital, and in most of the cases, they were discharged from the hospital after a day or 2 days. So this, I think, is the most common serious effect. There was one serious side effect from the Janssen vaccine a year ago. It was a clotting problem, and this occurred in 7 out of every 1 million doses that occurred, and it was mostly in individuals between the ages of 18 and 50, and it was predominantly in women. And so as a result, there were some warnings that were placed into the J&J vaccine. So these are the things that occur. the one thing I'll leave you with is that no vaccine and no medicine is without risk. I want you to also keep in mind the concept of thousands of airplanes fly across the world every single day, and you don't hear anything about it until one crashes. And so, are you going to stop flying because one plane crashes? Flying is not without a risk. You know, any plane can crash. So I think that you have to sort of put a lot of this into perspective.
Thank you, Doctor. And I want everyone to just take stock of what just happened, because on the news, whether it's CNN, MSNBC, Fox, you had doctors come on and basically just tell you and talk to you, right? But just talk. And it wasn't really so much a back and forth, or it really wasn't a conversation, okay? What Dr. Hewlett just did is he addressed the concern that many of my parents that I work with had, that I had myself, and I'm pretty sure that some of you on this call had. And not only did he give you the facts and the stats, but he gave you the honest truth. And at the end of the day, taking the vaccine does have some risk. But like the doctor said, just because one plane crashes every 5 years, there are millions of flights. And it is generally almost 99% safe to fly, right? So we need to keep this concept in mind. And again, I bring this up because, again, this is a conversation, right? We're not talking at you, but we're having a dialogue. Next slide, please. Now, if you've been listening, and I hope you have, because I know I'm the greatest presenter ever, along with Brother Early, I've been bringing up the fact of us having a dialogue, about us having a conversation, right? And you might be saying, like, all right, well, he keeps saying this, right? But there's a reason why. There's a reason why I keep saying these key words. And that's because, specifically, when it comes to the Black community, when it comes to the low-income community, okay? Low-income communities, it's very easy to say, hey, you know, COVID-19 is bad. Go get the vaccine. But if you're a single mom and you're working 2 jobs and you don't have time to take off work, what are you supposed to do? Or I'll give you one even better. Okay. When the pandemic hit, and just for clarity and just for a little background, my specific title is I work particularly with parents who are disenfranchised, who are in shelter, okay, and who are really the most disenfranchised in the city, okay. I had parents coming to me and asking me, like, hey, where can I go to get a test kit? Where can I go to get the vaccine? Right? And of course, in the early stages of the pandemic, it was hectic. But just like everyone else, through the months, I helped them, okay? Find, whether it's regardless if they had insurance or not. And again, because I'm dealing with the most disenfranchised, a lot of my parents didn't have insurance, okay? But just because they didn't have insurance, that doesn't mean you can't be seen by a doctor. That doesn't mean that you can't have a relationship with a doctor or have a primary doctor. And it doesn't mean that you couldn't get the vaccine. But I found very early on, and not as much, but a little bit today, that for some reason, it's out there that you need health insurance to get the vaccine, which I know is false. But the fact that I still have parents and I still have people who think that. That means that we still need to do a better job of letting it be known that if you want the shot, if you want the vaccine, you can get it. So when it comes to, and you're having issues, whether it's you're trying to find a good health provider, you're having issues with insurance, okay? Go to your Google, type in Google, and then just put in know better, live better, okay? If you type that in to your web browser right now, it should take you straight. The top hit will be this website. And once you get on the website, there's a whole bunch of stuff on there as far as plans that you could do to be healthy, activities, but most importantly, there's resources. So if you're having issues, whether it's, hey, I need health insurance, or I don't have a health insurance provider, what do I do? Go check that site out. Language or cultural barrier, right? Because guess what? My Spanish is okay, but another thing that I ran into was that a lot of my Spanish-speaking parents were afraid to get the shot because they didn't understand. They didn't understand as far as, one, that you didn't need insurance. So it's small stuff like this where even something as simple as like, hey, go into this website, checking out these resources can do a whole bunch of good. And if anybody on this call right now, if you are still having issues, whether it's you having questions, I implore you to check out this website. And I implore you to ask your questions now. Next question. I'm sorry, next slide.
Well, with that being the case, kind sir, being that, and you're included in this, we're in between generations. So, yep. Dr. Hewlett, something just came to me, and I'm looking at language and cultural barriers, and then I'm thinking about generations. You know, the when we look at the vaccine hesitancy, Tuskegee experiment, old school remedies. You know, believe it or not, it wasn't until later that I realized that ginger ale doesn't actually cure everything. Can you touch on some of the things that we sometimes are taught via the elders of the family?
Yeah, sure. I think that the beauty of this program is that we are trying to work across generations. And I think that at one end of the spectrum, those of us who are in the more seasoned area, if you will, a lot of people aren't really computer savvy. A lot of people still like to have a newspaper in front of them, and they like to write on a pad, and they may not be able to get into websites. And we have to be able to address the needs of those individuals. At the other end of the spectrum, you have people like my children, and like I'll mention Farah, who are very savvy with all types of media. And they don't even, not Farah, but I'm just saying there are people that don't even want to use email anymore because they like to use other types of media. And so we have to be aware of the fact that how do we best communicate with our younger generation, you know, Instagram and TikTok and all of the other things. And I'm told that even Facebook is out of style. So I think that it's important for us to keep up with all of these things so that we can understand how we can communicate to everyone. And we have to adjust it to everyone. And I think that that's what we have tried very hard to do with this, with this initiative. But you're absolutely right. You know, we have to go across generations.
Yes, definitely. Hold on, because the chat was going off. I want to make sure that we cover everything. I did want to go back real quick, Rob. Hold on. Wait a minute.
No, of course.
We answered that one. This one was asked a little earlier. Remdesivir is considered and billed as a clinical trial. When do you think this drug will be considered standard and no longer in clinical trial?
I haven't actually kept up with the status of that. I think that what happened with this pandemic is that a lot of medications which were proven or shown to have effectiveness early on and were shown to have a level of safety early on, they were given what we call the emergency use authorization by the FDA. And so what that meant is that on an emergency basis, they were used because of the severity of the pandemic. And the drug saved a lot of lives because it was used in our hospitals for severely ill patients. With that said, when you give emergency use authorization, that means that the clinical trials still have to go on. And it means that at some point, the FDA is going to have to review all of that data. And so the problem I think that we face is that the FDA has to review all of this. The FDA also had to review all of the information on the vaccines, on all of the vaccine products that were coming forward. They had to review all of that. Now, for those of you that have a reasonable memory, think about what happened to the FDA 2 or 3 years before this pandemic. If you look at any headlines from 2017, 2018, just Google FDA budget cuts, and you will see that the budget of the FDA was cut drastically. And so a lot of the people that would ordinarily be in the FDA working, they're not there anymore. And so I think that as a result, our response to this pandemic has been hampered because of some of the cuts that were made to our agencies before this pandemic hit us. But I think eventually there is going to be approval of remdesivir. I mean, that was the original question. And the same is true with the vaccines. It took a while before we actually got full approval for the first of the vaccines, and I think the others are going to be following.
Thank you, sir. You bring up the cuts in FDA, and all I can say is one of Newton's law of motion. Every action has a direct and opposite reaction. So it's
Right.
just
Yeah.
If
If you check again, I don't want to digress too much, but there's one famous quote by the former head of the Centers for Disease Control, and this was made, a comment that was made, I think, in 2017 or 2018, and he said, with these kinds of cuts, you're going to cost the lives of thousands of people. That was what was said before the pandemic. And so you can look that quote up, those that are interested. Dr. Thomas Frieden, he made that statement in the CDC, and it was in conjunction with cuts that were being proposed at that time. And now look at what we're dealing with baby formula. Everybody's pointing their finger at the FDA saying they're not doing their job. And the baby formula problem started because you had contamination at one of the big plants. Now, how do you avoid contamination? Well, you make sure that you're inspecting. Now, how do you inspect? Well, you have to have people at the FDA to inspect. So if you fired all the people at the FDA and you cut the budget for inspections, you're going to have fewer inspections. You increase the risk for having contamination, and you have contamination. So then the plant has to be closed down, and you've got no baby formula. And that is the kind of thing that everybody on this call, you're all critical thinkers. You're all very, very smart people. And these are the kinds of things that I think we're obligated to explain to other people so that they understand why a lot of these things are happening to us in our society, especially to us.
Here. You said a whole lot right there, sir.
Yes.
Just a quick question. the waiting period for boosters? Is it still 5 months in between, or what is it?
It's still 5 months as I understand it. That's what I've heard. Now I'll have to check and see if there've been some changes, but I think that it's still 5 months.
Okay, okay. I'm just going down quick, Rob, in regards to some of the questions. Establishing a relationship with your clinician is essential to good health. What are your recommendations in choosing a good clinician?
Well, I think in terms of choosing someone, one of the things that you can use is individuals that you trust. What has been their experience with their physicians? That's one way. The other way is to look at what we call board certification. Board certification doesn't guarantee that a person's going to have good bedside manner or that they're going to be a good communicator, but what that means is that they have essentially passed examinations that allow them to hold themselves out as an expert in their field. So if it's internal medicine, or if it's family practice, or if it's surgery. So that is really another way to do that. And you can see that when you look up a person's profile, if they're board certified or not. That's another way to do it. But I think that looking at the experiences of other people with a given physician, that is often very helpful.
Great. Thank you. Thank you. This is good information. Trust my doctor. Shout out to Dr. Hewlett for detailed and in-depth explanations. We have additional information. We touched on this a little earlier, Rob. Dr. Hewlett, does your immigration status matter? Can you get a free vaccination if you are not a citizen?
Yes, absolutely. And I think that's one of the important points, especially what Brother Bowen was bringing out about some of the people that he's taking care of here in the Bronx. In our health department in Westchester, and I think the health department in New York City, it doesn't matter what your immigration status is. And we try to allay fears that people have. I know a lot of people who have migrated to the country, they're fearful to come into a public health place because they're afraid that they might be apprehended and there might be issues related to deportation. And I think that's a real concern that people have, but we want to make sure that everyone knows that these vaccinations are available to everyone, as well as the antiviral treatments are available to everyone.
Great, thank you. So that just answered that question. Okay, got that. Most of the questions and thoughts have been about symptomatic people. How often should asymptomatic persons be tested?
That's a good question. If you're asymptomatic and if you were exposed to someone, let's just say you go to a gathering and you may have let your guard down because everybody there was vaccinated. This happened to my son-in-law and my daughter over Christmas. They went to a gathering and they found out 2 days later that from the lady who hosted the gathering that there was someone there who was positive and she was positive and they were sitting right next to her. And so, of course, they were tested. It's important because many people are asymptomatic. And so if you were in that kind of a setting where you're in close proximity with someone who was positive, whether they were symptomatic or not, then it's a good idea to get yourself tested roughly 3 to 5 days after you were exposed. And it's also a good idea during that period of time to really limit your exposure with others until you make sure that you are also negative.
I hear you. Thank you. Thank you. Okay. I'm going to go back to sharing my screen.
All right.
And we have 3 questions to know better.
Okay. So everybody sees the questions on screen, okay? But as I've stated, throughout this presentation, when it really comes down to it, right? And again, Dr. Hewlett has been an encyclopedia of information, okay? The fact that if you're able to have this kind of dialogue with your healthcare provider, with your doctor, okay? A lot of the questions that you may have, or a lot of the apprehensions that you may have, you may see that a lot of questions you have can get answered, okay? But when you look at these questions, what is my main problem? What is the main thing we talked about today? What do I need to do? Or why is it important for me to do this, right? It's about awareness. It's about if you feel, or if you don't have a doctor right now, or you don't have a doctor that you're comfortable with right now, you know that you can go in this chat, or you can go to the website of Know Better, Live Better, okay? And you can look up doctors in Westchester County. And I can tell you that resource page is still being updated. So what you see today could be even more tomorrow, okay? On top of a lot of the things that we talked about today, as far as questions being answered, immigration status does not matter when it comes to the vaccine. When it comes to side effects, okay, nothing is 100%. But the key question that you should ask yourself, and which what I had to ask myself, okay, is what gives me the best chance to be on this planet? What gives me the best chance to keep doing what I love to do, which is help the community? And that is the vaccine. Okay. And you know what? If I have any other questions, is there anybody that I can go to that I can trust and talk to about that? All right. So just when you look at these questions, and again, I always bring it up, dialogue. Okay. Next slide, please. All right. So I've spoken about the resources, and as you'll see right here on the screen, okay, you can take a picture of it, or all of these resources that you see here are on the website, Know Better, Live Better, right in resources. But this just gives you just another tool in your toolkit, okay? It's not a business card, it's not a handout, it's not a billboard. In this day and age, I would like to think that almost everybody on this Zoom call has a phone. So guess what? If you have a question, or you're wondering if there is a doctor in your area, or if you're looking for some kind of health service in your area, just go on your phone. 2-minute search will take you to the website, and you'll be able to see resources such as this. Okay. Next slide, please.
The reminders.
So, and it almost seems self-explanatory now, because it's been talked about ad nauseum for the last couple of years, right? But at the end of the day, what you see on screen is just one of those things where it's like, hey, just because you have the booster doesn't mean that you are now the Hulk or Superman, all right? And just because you have an infinite amount of COVID tests does not mean that you can't get the virus, or that if a COVID test, if you took it and 1 minute have COVID, that the next minute you can't get it. All right. And there's nothing wrong with erring on the side of caution. Okay. If you're in a situation where you're not feeling well and you're not sure, and you don't have a test available, you don't have a kit available, right? There's nothing wrong with going on the offensive and saying, you know what, I'm going to isolate, or I'm going to quarantine until I can find out for sure if I have COVID or not, right? And then on top of that, just the preventative measures, whether it's masking indoors or washing your hands. Now, it might not be mandated now, but that doesn't mean you can't do it. On top of the fact that, on top of masking yourself and washing your hands, eating better, exercising a little bit more, guess what? You know what that does? That boosts your immune system. Boosting your immune system gives you, it builds your body up to the point where it's like, you know what? If you do get COVID, right, your body is in a healthier state. And you rather have your body in a healthy state to fight this kind of disease. But again, these are, I don't have to talk about it ad nauseum because we've all heard it before. But this is just reminders that it's like, hey, you know, we all may wish that the pandemic and COVID was just over with, but it's not. So we still need to continue to be diligent, if only in some way. Next slide.
So quick question. With these reminders, as I'm looking at them, and in the current state of the increases in the rise of infections going on right now, Dr. Hewlett, is it possible? I mean, I think we know the answer to this, but how many times can someone get COVID?
I don't think we know the answer to that yet. I think we know that there certainly are people who have had it more than once. And I guess there's no real, I don't think we know the answer to that yet. I think the thing that we do know is that for those who are vaccinated, hopefully it will include most of the people on this call. If you do get infected, you are less likely, far less likely to be hospitalized, far less likely to have severe disease, and far less likely to die as a result. But the vaccines are not 100% in terms of preventing you from getting infection. But most of the time, it's going to be a very mild kind of an illness like a common cold, as opposed to being so severely ill that you have to go to the hospital.
Gotcha. Thank you.
Okay, so rather than give stats, and I'm very big on this as far as I like to use myself and personal experiences when it comes to, you know, when I try to interact, especially when it comes to parents. And when it comes to specifically this, when it comes to COVID-19, what resources or what things do I trust? Okay. And when I'm trying to talk to family members as far as getting booster shots, okay, or it's now talked about more, and I'm very thankful for that, but it was a conversation that wasn't talked about as much 10 years ago, and that's mental health, right? What I've done, and whether it's with my parents, whether it's with parents that I work with, is I let them know that at the end of the day, when it comes to COVID-19 and being and trusting certain health information, when I talk to my doctor and I look him in the eyes and he talks back to me, I'm not talking to the patient, he's talking to the person, okay? Not only that, when it comes to the booster shots and speaking to family members about that, rather than go and I don't try to make them feel as if, oh, you're the worst person in the world for not getting the booster shot. I like to keep it as simple and as real as possible. I love you, and I feel that taking this shot gives you the best chance so that I can be around you for as long as I can. And that's it, right? Rather than, I don't want to use the talking points that you hear on MSNBC or CNN or wherever. It's just from a real perspective. When I'm speaking to friends and family, that you know what, I want you to get this booster because I want to have the best chance to have memories with you moving forward. And then for the last piece, the piece that is talked about more but it wasn't talked about so much 10 years ago. Mental health. I talked a little bit earlier in this presentation as far as how can stress can just hurt you. You can be sitting down and all of a sudden your back hurt because you're so stressed out. How your mind is can affect your body. And now, thankfully, especially in the Black community, we are really having real discussions about mental health. And I'll say this because this is the same advice that I give to my parents. And this is the same advice that I give to parents that I work with. That you know what?
Coach Laura's up there. You can't see her.
If you're feeling down,
I believe she's right there in the middle.
feeling like you need to talk to somebody,
The one holding the ball.
okay? Don't keep it inside. Reach out. There are people here that want to help you. And if you want a number, if you need a location, we can find that. And with everybody on this call, again, know better, live better, type it in to your search bar. And when you go to resources, look up mental health resources if you need it. It's not about being pressured, but it's about knowing that if I need to talk to somebody, but I don't want to talk to loved ones, my wife, my mom, my dad, my best friend, right? They might not understand. There is somebody that you can talk to. Because guess what? And the stats will prove that this pandemic has done more than take lives because of COVID. But the rate of depression and the rate, unfortunately, of suicide has gone up. And when I say that because I want everybody on this call to know that you have people you can talk to. And it's bringing this awareness, not just on this call, but to anybody I talk to, that you have somebody that you can talk to. The dialogue that we've had with Dr. Hewitt, okay, and the resources that we give you now, COVID, mental health, finding a health provider, or finding a new doctor. You can find that, and it's only a click away. Okay.
Thank you, sir. Hey, and I know once again we focused on COVID. You know, Dr. Hewlett, this question that just came up, I don't even know if you can answer this, because when you look at what's going on in New York City right now, and the new administration is trying to address certain things that are, going on in the subway system, and of course out on the streets and in the shelters. How can you get help for a mentally ill person who doesn't want to get help?
Well, that's a tough issue. One of the things I think that we can start with is for the relative or the loved one, it may be the parent, it may be the son or the daughter, they can actually seek advice from a mental health professional. And sometimes by talking with that professional, you can actually get some ideas and some tools that you can use to help have conversations and a dialogue with your relative or your friend or whoever it might be to get them to engage. And so don't give up on the person. You try to get some of the tools yourself. And not being a mental health professional, if I'm in that situation, I'm going to try to contact a person who has that expertise, and I'm going to talk with them and describe what's going on and see what they will recommend. And I have done this. I know some people that are practicing psychiatry, and I called them they've given me valuable information that I've been able to share with friends and with other family members. And they eventually were able, to get that person into some sort of a dialogue. So I think that is something that you should consider.
Awesome. Great.
And then actually,
A resource was entered into the chat just now too, but
yes,
there are resources certainly at our health department. We actually have access to mental health professionals, and so we can help with some of that as well.
Yep. And I actually would add on to that as far as, because this, again, is kind of part of my work, that one of the things that we like to stress is as far as letting the family know who might be going through this, that because one thing I tend to hear a lot is cost, right? Cost. How much is it going to cost? Okay. And again, it's a great thing now where, because the mental health discussion is really come to the forefront now more than it ever has, insurance providers, and many people don't know, but insurance providers, okay, are now making it very affordable to get mental health, as far as mental health counseling. But however, if you don't have insurance, it's also becoming more widely available to get free mental health counseling, even if you don't have insurance, right? But again, it's getting this information out there, and I would implore anybody to check out the resources that we're just put in the chat, or check the resources on Live Better, Know Better, because quite frankly, now I go by this as far as, just because there's a lot of information, there's a lot of organizations, but it doesn't matter if the people who need it don't know about it, right? So whether it's in the chat or you check the website, those resources are there. And even in the city, there's thousands upon thousands of organizations that will do mental health counseling, okay, with an individual. If you have somebody who doesn't really want it, okay, they actually have strategies for that, okay? It's there. Mm-hmm.
Thank you. I'm going to share this last slide. And I would like to thank everyone that joined us this evening, but especially kudos and thank you to Dr. Hewlett, Farah and Erica from all three from the Department of Health. We thank you once again, myself, Andre Early, and Robert Bowen. If you have any, this is our email address, but for Know Better, Live Better, feel free to look at this website, as well as email if you have any questions, comments. This was amazing. So on behalf of the Nourish Your White Plains Alumni Chapter of Kappa Alpha Psi, we thank you for joining us. I trust that, we trust that you were able to gain just a little bit more insight of what we are all going through right now and what we have to navigate. So thank you. This was amazing.
Thank you.
Yes. Again, thank everybody. Thank you for joining us tonight.
Good evening.
Thank you. Thank you. Oh, I'm sorry. Before you sign off, I know it just came in. If you can, click on the link that says post-session evaluation. There is an access code. Of course, it's not mandatory, but please feel free to add some insight, some feedback. This was amazing. Thank you.
Yes.
And I'll just say one thing too. I think that what both of you brothers are doing is exactly what the founders of this organization intended for us to do. And that is to provide leadership to help our society and to help specifically people in our African American community to have better lives. And so I applaud all the efforts that were made tonight. And Brother Bowen, you did a fabulous job. So thank you.
Thank you, Dr. Hewlett. Of course, I couldn't have did it without my mentor and brother Early. But, you know, again, this is the kind of forum that we need. And
Yes.
honestly, again, I feel the best way to really communicate somebody's message is to be honest. And I was one that I was not for the vaccine. I was very hesitant because I was hearing all type of stuff. And not only that, I got tired of people talking to me and just telling me what I had to do. And and it's almost like they were talking, they weren't listening. And that it's almost as if we forget that it's always a two-way conversation when two people are talking. And then I got even more mad because I felt like if I had questions, especially in the early stages, you get demonized. You will get demonized, especially in the Black community where we have a reason to question. But this is where I use my personal experience. So then when I communicated it to parents and I said, hey, you know what? I was hesitant. But you know what? I had conversations with my family, my friends, my brothers, my doctor. And then after I had all those conversations, I finally came to the conclusion, like, you know what? I want to spend more memories on this planet. If this shot gives me a better chance of doing that, I'll do that. But it took me all of that. I didn't want to just listen to the TV and just be told. So it's like now when I'm speaking to parents, I tell them that. And, you know, I'm hopefully, you know, from what I've heard, I've been able to change a few minds. But I think this is the forum where we change minds, where, you know, anybody who's been hesitant, especially when it comes to the adverse effects, forums like this, you know, where I'm not being told, I'm just, you know, we're just answering and we're listening, we're questioning, and we're giving answers to those questions.
Okay.
So,
Right.
so we're wrapping this up, but it's interesting that you brought up something, Brother Bowen, and I was like the complete opposite. I'm like, yo, they need to hurry up and get this vaccine out. You know, I mean, that's just how I am, because I think of it like this. All right, how often do we question what is in our food, what is in our drinks, what is in what we smoke? Like, I'm sitting here like, really? Y'all don't question that, but then y'all gonna question this over here? What's the difference? What's the difference? But I digress. I digress. I can go on and on and on.
Good night.
Brother Hewlett, thank you once again, everyone.
You're welcome.
We're about to stop recording and sign off because I'm about to get real.
Good night.
Thanks again, everyone, and have a great night.
Thank you, and good night to you all. Thank you so very much.
Of course. Thank you for joining us.
Amazing presentation as usual. Thank you, brothers.
Ooh, I know that voice. I know that voice.
President accounted for. Love
Yes,
it.
sir.
Love it. Love it.
Love you, bro.
Man,
Thank you,
back at
Brother Early,
Oh. Thank you.
for putting this all together.
Thank you, Brother Morgan, for letting us know about it.
Thank you. And I just want to say thank you to the brothers in Kappa Alpha Psi for putting this on and also encouraging us to share it with our community. We had a number of members from our church that were on. I was really hoping for more, but if we just enlighten one, when
That's
that
right.
one enlightens one more and enlightens one more, we've got a whole cavalcade of knowledge that's going to go forward.
That's right. That's right. And this is just the first of a series. So
Right.
we'll be coming back again.
Yes, we will. Yeah. And I'll try to be a little bit better. I know I was a 10 this time, but next time I'll try to be 11. 11.
Yeah. We'll talk about that. We'll talk about that.
Hey, you got to leave with a joke. That's what I was taught. That any presentation, you have to leave them. You have to leave.
You already know. Hold on one quick second. Farrah, I don't want to lose you. I'm just gonna make sure.
Good night and thank you.
Good night. Thank
Of
you.
course.
Thank you.
Have a great night.
You too. Good night, everyone.
Good night. Thank you.
Good night.
Awesome, awesome, awesome.
Awesome. We did our job. Thank you.
Yes, we did.
Yes. Good night. Congratulations on your first rollout.
Hey.
You did great. Good.
Hold on for a second, Erica.
Okay.
I can't get one.
And that's us. Okay. So Farrah, Erica, thank you. We honestly, I didn't know how this was gonna go. I mean, I know we were just gonna go with the flow and all that. That's what we do.
That's all we want. That's all
Just a
we
little
want.
bit.
I had fun and I'm so glad that there was engagement and feedback. The questions were great.
Yes, they were.
Yeah. I mean, really engaged audience. I mean, this is like the best outcome we could ask for. And what you did was great. I mean, you used your judgment to do it in the order that you felt was best.
Mm-hmm.
If you feel like, all right, we talked enough about this, we can skip this slide, like that stuff is totally cool.
Right.
Yep.
Right.
Yeah.
Yeah.
So
yeah.
On logistics. So have you ever downloaded an attendance report from Zoom?
we did, and it was like as of a few days ago. So I'm actually going to have our guy download it again, which will list all of our registered participants.
Yes. Yeah. So it should, it's a report that says like the timestamp that they came in, came out, and it should have their email as well. So then when you send that to me, I can send the gift cards to all the emails registered.
Perfect.
And then do you all have a standard invoice that you send to people, like when you do a service and you invoice them? Do you have anything like that?
I believe so.
Okay. If not, we've been making some because most of our partners don't have their own. So we just made one for them. So I'll put the payment that we owe you, Kappa, for this session. There was more than 20 people I counted. So that's the max payment. So we'll invoice you for May. The finance does it monthly. So I heard they dispense the payments pretty quickly. So once all we need to do is send them the invoice. I'll give it to you for approval and signature. Actually, Stephanie will. Stephanie does those documents. So you'll hear from her and me soon with that. Finance will do the rest. Hopefully it should be pretty easy.
Yeah.
Okay.
Okay. I know we have another one scheduled for, when is that, Erica? June? Wait, I'm sorry, Erica, which one does that fall under? Is that falling under us or you? Or you
That's
guys?
you're the trusted messenger. you're the trusted messenger, and you're hosting. So we're going to provide you. Rockland County is going to provide you 30 participants from Delta. So Delta is going to find 30 participants in the community, and you guys, whether you want to tag the same way that you did it, can actually trusted messenger. And I told her I was going to, hang back to talk with you now, but Cynthia was actually on tonight. I wanted her to see what it was like. So she actually had it. Yeah. So she got a chance to see the platform, and you'll do the same thing that you did. You're the trusted messenger, and they're just going to provide you the participants.
Cool. Oh, okay. All right.
Yeah,
So,
I held the date for you. I held June 15th at 7. Yeah. Okay.
That's it.
So okay, that's the time. Okay, so she did want to know the time. So it's going to be 7 o'clock. Same thing.
Mm-hmm.
Okay. So
all right. She did
Rob,
want headshots for you guys. She wanted headshots.
For what?
Because this is PR. She's, this is what. This
all right.
I'm just.
No glamour shot.
I fight marketing like that. I don't like my face on display.
So you want to go with? How about you, Brother Bowman?
Oh, I'm the exact opposite. Let's go.
Let's do
it. Smile with a mile. As you can see, I'm the comedian. So it's again.
If they get it, because to be honest with you, it was about 4 of them on tonight. They probably want to do it more than once. I mean, it was great.
Mm-hmm.
Yeah, I'm
it's helpful for her. Like we have all of those different logos in the shared folder. So whoever you're communicating with, if you want to give her those files, I don't know if that's helpful to her for pictures or flyers.
You mean the stamps that we have for Know Better, Live Better? Yeah. I actually gave her the watermark and the brand that we use.
Okay.
And then so since Andre and Robert's going to be the trusted messengers co-hosting.
Yeah, we if you haven't noticed, we kind of feed off each other.
Yeah, it was great though. It was really good. And Farrah was on time. People were asking questions, and she was dropping those.
And let me tell you that, like, I don't know. Of course, behind the scenes, everything happens behind the scenes.
Yeah.
Like, because I wasn't supposed to be in charge of the presentation itself, but my go-to person was actually involved in another call, and he probably just got off it like 10 minutes ago. So that's why we had to go back and forth with the shared screen, because I had to monitor the presentation as well as the chat box and while I was talking. So.
Okay. Yeah.
We would have never known it.
Yeah, I mean, that's pretty good because we haven't had anybody take down the slides while people were discussing, but I actually think that's kind of an effective strategy anyway. So.
Oh, definitely. I definitely think that's better.
Yeah.
That's when I present. That's usually how I like to, because when the conversations, especially when the questions start going, and of course there's always a question that everyone has, but they don't ask, and then we get answers that everyone really needs, and so it worked out.
Yeah. No, it was perfect. Okay, cool. So then I'll just you'll send me the report, and then I'll send you a confirmation after I've sent them. If somebody tells you they didn't get their gift card, let me know. Amazon usually sends me the timestamps and stuff, so it's usually in their spam folder, but we can check for typos and stuff.
Okay, great.
Yeah.
And for the next one, is it going to be the same Zoom link? Because I think that's what she wants to put on a flyer as well. Are you're gonna stick with Zoom?
Are we gonna stick with Zoom?
Right, for your registration link. So
are
you gonna create that?
What we'll do is we will create another Zoom link.
Okay.
And get that to you. So that's confirmed June 15th.
7 o'clock. Okay.
7 p.m.
You got it.
Perfect.
All right, all.
All righty.
All right, thank you. Good night.
Great evening.
All
Have
right.
a great one, and I look forward to seeing you guys soon.
Yeah,
All
see you
right.
next time.
All right.
Have a great night, everyone.
Good night.